Hello, welcome everyone. Thank you so much for joining us. We will let folks get settled into the Zoom room and we will be starting momentarily. All right, welcome. I know a lot of you are still joining us, but we are going to get started. Thank you so much for joining us for our Advocating for Change, How to Influence Opioid Policy in Your Community with your presenter, Humberto Carvalho. Thank you so much for being here today.
Good afternoon, everybody. It's a great pleasure to be here today. Like Alisa said, our topic today is advocating for change, how to influence opioid policy in your community. So let me move. So before we start, I just want to give you my disclaimer. This presentation is for informational purpose only. It does not constitute legal, financial, or professional advice. The views and opinions expressed here are of the author, which is myself, and does not necessarily reflect those of any affiliated organizations. So today, for today's presentation, the objective is we're going to actually identify some effective advocacy strategies for influencing opioid-related legislation, funding, and programs, especially in your community. We're also going to share some real-world examples of successful community-led policy change. And also, we're going to talk about some tools to engage decision makers, build coalitions, and mobilize public support. So I have, towards the end of the presentation, there's a set of suggestions that I'm going to provide for you, if you are in the process of helping to influence opioid legislation in your area. So let's start by taking a look at the U.S. national, opioid crisis. So, as we all know, the opioid crisis remains as a major public health challenge in U.S., though, recent data actually shows that signs of progress, both nationally and actually in some states. So if you look at historic scale, the opioid epidemic has actually claimed over 1 million lives in U.S. since the late 90s. The crisis began with prescription opioids in the late 90s. It escalated with heroin in the around 2010, and it peaked with synthetic opioids like fentanyl. In terms of recent progress, for the first time in years, the US saw, significant decrease, like a 25% drop from March 2024 to March 2025 in opioid overdose and opioid use. So the current toll, is still, high, despite of the decline, the overdose deaths still remain high. According to CDC, in 2024, the total overdose deaths are estimated about 80,000, down from 110 in 2023. And also, fentanyl remains like dominant. Synthetic opioids, especially illicit fentanyl, continue to drive the majority of the overdose deaths. And fentanyl is actually often mixed with other drugs, which increase the risk of fatal overdose. So what are some key interventions that actually have been showing progress in this area? One is the expanded access to naloxone. The other one, which actually has saved countless lives, as you know. Also, the increased availability of medications for opioid use disorder, which is helping more people recover, and also the growth of prevention programs and community-based response. And lastly, some federal and state investments, like in data-driven prevention and treatment programs. Like settlement funds and public health policies actually have begun to shift focus towards like prevention, treatment, and recovery rather than punishment alone. So these are some key interventions that actually has helped to change the scenario. However, like everything, challenges still remain. Despite encouraging signs, the battle is actually far from over. The crisis disproportionately still affects marginalized communities, like including Black, Indigenous, and rural populations, which highlights the need for culturally responsive and equitable interventions. Several series like threats could stall or actually reverse some of the programs that are already in place. For instance, some more potent, less predictable synthetic opioids, which continues to enter the illicit supply, often without users actually knowing what they are taking. Also, the access to treatment is still far too uneven. Many people who need help, they cannot get the help they need due to like insurance gaps, geography, like stigma or lack of resources. There's also social determinants and inequities, such as like poverty, underfunded health systems, which actually drive higher risks in vulnerable communities. And also the risk of complacency, which is actually quite real. When numbers improve, the urgency suddenly disappears. And, you have to remember funding and attention, they must remain consistent. So moving forward, to sustain and deepen progress, we must actually commit to the following. We need to commit to invest in prevention upstreams, address like overprescription, ensure alternative for payment management, also tackle social determinants before they actually lead to addiction. And we also, need to expand access to proven treatments. Make medication-assisted treatment widely available while long-term support rather than short-term fixes. We also need to scale up prevention programs like naloxone access, like drug testing tools, also safe use education, which must be normalized. And also strengthen policies and funding with accountability. Like settlement dollars in public health budgets, they must actually go to real measurable community solutions, not to areas that actually don't make sense. And also, we need to open the conversation and fight social labeling. Addiction is not a moral failing, and we must actually apply recovery stories and treat people with compassion. So now that we actually took a little we grounded ourselves in like in the scope of the urgency of the opioid crisis, let's actually explore how policy decisions shape the response and how you can actually influence them in your own community. So if you think about the opioid policy in the United States, it's actually shaped through a layered system of federal, state, and local governance, each with distinct roles and influence. So if you look at the federal level, you have legislation and funding, which is the federal level is responsible for the legislation and funding. Congress passed like law like the Support Act of 2018 that fund like prevention, treatment, and recovery programs nationwide. Then there's the regulatory agencies from the federal level, like the FDA, which regulates opioid manufacturing, labeling, and approval. There's also DEA that enforce, controlled substance laws and monitors prescribing patterns. And there's also like CDC and SAMHSA, which like provide guidance, data, and grants to states and communities. And there's also national strategies, which are, the federal agents, they coordinate like a whole of government approach to reduce opioid related harms, including expand access to medication for opioid use disorders and also naloxone. So this is under the federal level. Now, if you look at the state level, there's the licensing and oversight. States, they regulate healthcare providers, the pharmacies, and treatment centers, through licensing boards and like health departments. There's also the prescription monitoring programs. Most states operate, the PMPs, like to track opioid prescriptions and flag potential misuse. There's also the Medicaid policy, which is under the states. The states determine the coverage for addiction treatment service, including medication for opioid use disorders and also behavioral health care. And there's also, state legislation. The states, they pass laws on naloxone access, like Good Samaritan protection, and also syringe syringe service programs, and also criminal justice reforms. And obviously, the caveat is that in each state, these laws can vary in these regulations. And then we have the local level, which has several important steps, which is that's where the implementation and innovation happens. The local governments and health departments, they actually execute state and federal policies, often tailoring them to the community needs. The public health campaigns, they are also a local level. Like cities and counties, they like run education, outreach, and stigma reduction efforts. And there's also the law enforcement and first responders. The local police and the EMS, they actually play key roles in overdose response and diversion programs. And there's also the community coalitions, the grassroots groups, which influence local ordinances, school policies, and resource allocation. So in short, as a summary, the federal policy sets the framework, the states adopt and enforce it, and the local communities, they bring it to life. The effective advocacy obviously requires understanding of how these layers interact and where your voice can make the biggest impact. So some common like opioid policy areas are the following. The naloxone access and prevention services, also the treatment funding in zoning for clinics, also recovery housing and employment support, law enforcement diversion programs. There are many others, but here are some examples. For instance, you have the Support Act of 2018, which, the SUD prevention that promotes Opioid Recovery and Treatment Act, which expand access to treatment, recovery service, and telehealth for opioid use disorder. You also have the Affordable Care Act of 2010, which strengthened coverage for mental health and substance use disorder treatment, including, parity protections for insurance coverage. You also have the Americans with Disability Act, the ADA, which protects individuals with substance use disorder from discrimination in employment and public service. And there's also the 21st Century Cures Act of 2016, which provided funding for opioid treatment and prevention programs, including support for state level initiatives. Now, some common barriers to opioid policy, that change, that influence policies. There's some barriers. One of them is social labeling and misunderstanding. Like negative perceptions of addiction and prevention, like for instance, syringe services, methadone, the use of methadone, and which often leads to like resistance from policymakers and the public. Stigma can actually prevent people with limited experience from participating in policy discussions. There's also the bureaucratic and regulatory hurdles. Like federal rules around like methadone and other medications for opioid use disorder are actually complex and outdated in some levels, limiting access and innovation. Licensing and zoning laws can actually restrict where treatment centers or prevention services operate. There is also fragmented policy landscape. Opioid policy is actually shaped by overlapping federal, state, and local regulations, creating like confusion and inconsistency. Community coalitions often struggle to navigate this, patchwork system when like advocating for change. There's also limited funding and misallocation. Even with opioid settlement funds available, many jurisdictions, they lack clear plans of capacity to actually spend them effectively. Funds may be, diverted to like non-evidence-based programs or administrative overheads. There's also the lack of political will. The elected officials, they may actually avoid controversial policies. They may not, engage in controversial subjects, such like safe consumption sites. Also, due to the fear of backlash. Short-term political cycles actually discourage long-term investments in public health systems and infrastructure. And the last one here is like insufficient community engagement. Like policies often fail when they don't actually reflect the needs of the affected communities. And you lack like the input from the people with lived experience. The lack of the input from the people with lived experience can actually result like in ineffective or harmful interventions. So these obstacles slow the progress and limit access to saving life interventions. So now, what is a community advocacy in action? I'm sure that several of you have heard of that. A community advocacy involves like residents, organizations, and people with lived experience all working together to actually influence public policy, like improve service and raise awareness. It's actually grounded in local knowledge and driven by, collective action. Now, here's some examples. For instance, you may have heard of the healing community studies. It show that was a study that was launched in 2019. Which was across like Kentucky, Massachusetts, New York, and Ohio. This initiative mobilized 67 communities to actually implement evidence-based practice. It showed that community coalitions can actually reduce overdose death by coordinating like local efforts, improving naloxone distribution, and also expanding access to medications for opioid use disorder. There's also the SAFE project. Created the safe community playbook. They created the playbook, which is actually a step-by-step process of how communities can actually organize, evaluate, and create change. The playbook can actually serve as your framework, walking you through like finding the right team to lead your effort, actually working together to identify your like priorities, and finally putting your work into action. And there's also the peer naloxone distribution, which is programs where individuals with lived experience, they actually distribute naloxone within their communities, which have proven like highly efficient. And these efforts actually they usually bypass formal like systems and reach people most at risk. Now let's pause a bit and talk about implementation science, which is something else that you may have heard. Implementation science actually examines how research findings and evidence-based practice are effectively put into practice, into regular policy and practice. It actually focuses on understanding how interventions are adopted, and sustained over time in the real world settings. Communicating like implementation science to policymakers is actually absolutely essential, like for translating research into real world impact. Shaping like evidence informed policies and improving public health outcomes. Just to highlight this, just think, imagine if you discover like you have like a breakthrough intervention that could actually save life, reduce costs, and actually improve equity, and only to see it like installed in the real world because it never reached the right ear, the right person. So that's the challenge that we face when implementation science isn't like effectively communicated to the policymakers if they don't understand. So why is it that the policymakers they matter? Well, they matter because policymakers they pretty much control like the levers of legislation, funding, and regulation. They're the ones that make the machinery move. Also, their decisions directly affect whether and how evidence-based interventions are scaled, supported, or sustained. Without their buy-in, even the most effective interventions may actually never reach the population they are designed for. They're designed to help. So that's why the policy make matter. So what are some key reasons, to communicate implementation science to policymakers? Well, first, it promotes evidence-informed, policy. Clear communication helps the policymaker to understand what works, why it works, and how to implement it effectively. This leads to like smarter policies grounded like in science rather than ideology or anecdote case. It also improves adaptation and rollout. Policymakers they often they serve as like gatekeepers of implementation, Sharing insights on barriers, facilitators, and strategies helps them to actually design policies that are feasible and scalable. It also enhances health equity. Implementation science often reveals disparities in access and outcomes. Communicating these findings can actually guide policies that reduce inequities and actually improve population health. It also supports policy as a strategy. Policy itself can be a tool like for implementation. For example, like mandates, incentives, or funding mechanisms can actually drive the uptake of like an evidence-based practice. And it also, builds trust and collaboration. Like engaging policymakers in the research process forces mutual understanding and long-term partnerships. These actually increase the likelihood that research will actually be used in decision making. So, how to know what is important for policymaker? To know what actually matters for the policymaker, you actually must understand their priorities, their values, and also the political context that they operate in. So this means that align your message with their goals, current agendas, and public concerns. So, and here's how you do that effectively. First, you need to understand the policy cycle. The policy making typically follows a cycle that consists of an agenda setting, then there's the formulation of the policy, there's the implementation of the policy, and then there's the evaluation. And this cycle can reverse again and start it over depending on the results of the evaluation. So knowing where your issue fits in this cycle actually helps you time your input for maximum impact. So if the strategy that you feel that it's important to bring it up during the agenda setting, during the formulation, during the implementation, or during the evaluation, you know. So you need to time where it is that you can influence them. Next, you need to research their interests and values. Policymakers, as we all know, they're driven by what? By constituent needs, what voters care about, uh, party platforms, ideological alignment, also budget constraints, cost effectiveness, and also re-election goals, visible wins. To connect with them, you need to show how the issues support one or more of these drivers. That's how you get them to become interested in the issue that you're trying to present. Another important thing that you need to do is that you need to monitor the political and public discourse. You need to stay informed. You should track, the political debates to see, if you're targeting a specific policymaker or a specific group, you need to see what are their views during their political debates. And you need to see what policy forums and advisory boards, what it is that what they're talking about the issue that you want to discuss and be part of. You also need to follow the media coverage in public opinions polls to see, not only what is it that the media is talking about and how is the public reacting to it, because then you know how to approach it. So this actually help you to identify, the trends and the issues and tailor your message to real current concerns. So you also need to engage in stakeholder consultation. So what does that mean? You need to talk to the legislative aides, also to the advocacy groups that support that policymaker, also civil servants and community leaders, in a community. They can offer insights into what's gaining, traction and what barriers exist. This is actually especially useful for identifying underlying problems that policymakers may not yet have formed, clearly. So you have to remember one thing: a lot of policymakers, they are not very well versed, especially if you talk about behavioral health and substance use. A lot of them, they are not very well versed in the subject of substance use and behavioral health. So you need to make sure that, to attract their attention, that you actually need to bring specifics that would make them interested in the subject. So you frame your proposal around societal challenge. Policymakers, they respond best when you link your findings like to real world problems, and also when you offer solutions that are feasible and scalable. Obviously, offering solutions that are too like unrealistic. It's not helpful for anybody. Also, highlight social, and health impacts of the issue you're trying to advocate for. An example here: instead of saying this intervention reduce substance use, or be more direct, say this product can actually save $2 million annually in emergency care costs and reduce overdose death by 30%. So you pretty much said the same thing, but you added facts and you added, uh, things that drive the interests of the people who are involved in managing the systems. Also, you need to adapt your language and format. Use like policy briefs, like with clear recommendation. We're going to talk a little bit later about policy briefs. So also use infographics for simplify complex data, and also use stories and case studies to humanize the issue. And again, you need to remember that sometimes when you talk about specific like opioid issues, some policymakers they may not have specific backgrounds that would allow them to fully understand when you talk about the science part of addiction. So that's why it's important for you to tailor the information into like ways that it may be visual or with stories so that they can actually relate to it. Also, avoid jargon or overly technical explanations because they won't understand anyways. Also, your goal should be clarify, not make it complex, not add to to the complexity of it. So you need to ground your advocacy in evidence. This is absolutely important. Grounding your advocacy in evidence is actually important, specifically if like in academic policy and professional settings. And here's why. Well, it builds credibility and trust. Using like solidly like evidence shows that your position is actually informed, thoughtful, and actually reliable. Decision makers, and the public, they are more likely to trust and support arguments that are backed by data and by research. So also strengthen your arguments. Evidence helps move like advocacy beyond opinions and personal beliefs. It allows you to actually clearly demonstrate why a problem matters and what solutions are most likely to work. So also, like influence policy and decision making. Policymakers are and organizations. They often rely on research and data to guide their choice. Evidence-based advocacy is more likely to shape laws, programs, and funding priorities. Also, it improves effectiveness and impact. Advocacy grounded in evidence promotes like solutions that like have been tested and shown to actually work and increase the chance of like real lasting change. It also helps address counter arguments, which we are very well familiar with that. Strong evidence allows you to actually respond to criticism or misinformation with the facts, making your advocacy more resilient and persuasive. And also promotes ethical responsibility. Like advocating like for evidence-based solutions reduce the risk of like unintended harm and ensures that actions are aligned with the best available knowledge. So remember, again, policies they gain traction when they are backed by actually data such as like CDC or NIH, SAMHSA, or state health department reports. Also by like local overdose statistics such as like fatal or non-fatal overdose. Also cost comparisons like cost of treatment versus cost of incarceration. You know, we need to translate data into local impact, such as like, for instance, one way to say, last year our county had 42 overdose deaths. more than traffic fatalities. So you need to put it in perspective. So you need to use data that gives them perspective. Also, you need to build or join a coalition. Building or join a coalition to advocate for opioid issues is actually much better than working alone because the problem is actually very complex and actually affect many parts of society. So you have more influence if you're together, if you have a group advocating for this. So potential partners for a coalition or a group is like people with lived experience and their families, also physicians, pharmacists, EMTs, faith leaders, recovery organizations, public defenders and judges, teachers and school counselors, or anybody in your community that has a stake on the subject that you want to help to make a change. So, to communicate, a public health proposal effectively to policymakers, you need to use like clear, concise language, and you need to actually tailor your message to their priorities and actually present actionable recommendations, backed by credible data. So here, what I'm going to present now is like some best practice for effective communication with policymakers. First of all, you need to know your audience. You need to know who you're talking to. You know, you need to understand, are you talking to one person or a group of people? What are their roles? What are their values? And what are in any constraints that may be, for you during your conversation? Are they like legislators? Are they agency heads of local officials? What kind of influence do they have? Also, you need to align your message with their priorities, such as like cost effectiveness, like public safety or equity. Again, you need to find the interest that the individuals you're going to be talking to. What are their interests so that you actually can catch their attention? Second, you need to build relationships and engage early. You need to like meet with the policymakers or their staff before formal proposals. Before you put a formal proposal ahead, you need to meet with them because you're going to get impressions or what is it they feel, how do you feel, what do you have any inputs. So listen to their concern and adapt your message accordingly, because when you're going to write your final message, you should have like already a sense of how those individuals will react. Also follow up updates and remain a resource. Just because you provided the first input, make sure that you express that you are available if they need additional information or additional resources. Also, engage decision makers strategically. Don't start with a confrontation. That's the worst thing you can do with a policymaker is start confronting them. Start with like access. Effective methods like request a brief meeting, like a 15, 20 minutes meeting. Don't ask for a whole afternoon saying we need to sit to debrief this. You need to introduce the subject, in with, so give them time to absorb things slowly. Also, attend town halls and like committee hearings, submit like written testimonies, and also ask precise, actionable questions. An example would be like, what will it take for our county to fund 24/7 medication assisted treatment at the jail? That's an example. What would it take for naloxone be available in schools, in churches, in the library? So, simple questions. What would it take for this to happen? Also, use policy briefs strategically. Keep policy briefs short, in 1-2 pages, and focus. If you give a policymaker a 75-page document, it's very unlikely that they're going to read the whole thing, and that will actually divert their interest. Include like clear problem statement, evidence-based recommendations, expected outcomes and benefits, and also cost and feasibility considerations. That's, simple information, direct, so that the individual can actually absorb quickly and know what it is that you're trying to accomplish. Also, simplify and clarify. Like I mentioned earlier, Avoid jargon and technical language. A lot of policymakers, they do not have background in behavioral health or in opioid addiction, so they may not understand technical language. Also use plain language and visual aids like infographic or charts, and also frame your message around like real world impact and not like abstract theory. Very important. Ground your proposal in data and stories, combining quantitative data, health outcomes, cost savings, number of overdoses, any data you have with actual qualitative narratives, patient stories or community testimonials. There's nothing more impactful for a policymaker than actually hear a testimonial. If you give a policymaker saying, oh, 15 overdoses happened in this community in the past 3 months. So 15 is a very, for us who are in the field and understand substance use, 15 overdose, one overdose is too much. Okay. So, but individuals, they understand things differently. Oh, 15, okay, our community is like thousands of people. That doesn't sound bad. In fact, it does. So you need to actually make sure that you show specific data that give them context. Providing this dual approach of qualitative and quantitative data, makes your proposal like both credible and emotionally resonant. Also, offer clear, actionable recommendations. Don't just present findings, propose to them what could be done next. Because again, they are not experts. They don't know what interventions could be put in place. So if you just go to them and say, oh my God, this is happening, there's a continuous problem in the community, but what is the solution? What could the solution be? What steps could we take? So provide policy options like implementation steps and potential partners. Also, advocate for specific achievable policies. Again, you need to be realistic. Some things like, concrete goals, that outperform broad demands. Some examples are like expand naloxone distribution, preventive service programs, implementation of preventive service programs, also funding medication assisted treatment, or implementing Good Samaritan protections, or drug court reforms, post overdose outreach teams, treatment access in jails and prisons. So things that are actually realistic and they actually have been proven effective, and actually you have examples that actually has been implemented in other communities. Very important. Once you communicate your first finds or you have your first meeting, follow up and track the progress. Send thank you notes after the meeting. A lot of people think that this is actually very old fashioned, but it's actually very effective because it reminds the policymaker that they had that meeting. They meet with different constituents and they have different agenda topics. If a simple thank you note can actually bring the whole thing back at tone and remind the politician that they actually had that meeting. You know, public acknowledge progress. Any progress. Public acknowledge showing that the things have been, progress has been made, and also track votes and funding decisions, and also hold leaders accountable respectfully. Another very important thing is to time it right. Align your communication with the legislative cycles that I mentioned earlier. The budget planning or the public health crisis. Use windows of opportunity when public and political attention is actually high. So I mentioned earlier about drafting a policy brief. So what does the policy brief entails, which is something that anybody can do. Is actually very simple. So drafting a policy brief or a presentation that actually communicate your implementation science findings is actually a very important step for you to start your communication with your policymaker. First thing that the policy brief needs is a title and an executive summary. A title that is actually clear and specific, scaling evidence-based mental health interventions in public schools. So it's very clear and very specific. Don't create a title that's confusing and that is contradictory. And an executive summary is just something like 3 to 5 sentences that summarize the problem, the key findings, and the recommendation actions. Second, you need to include, the problem statement. You need to define the public health issue. How this came about, since when this issue started. Use data to show its scope, urgency, and impact, and gather data from the school, from the public health department, uh, from the clinic, or from the EMS station. And use local data so that the policymaker can because sometimes using national scope data is great, but it can it can be it can feel unrelated to the data of your community, depending on the size of your community. So gathering specific data of the community is actually very important and much more impactful. And also frame it in terms that matter to the policymaker. Frame it how that will save costs, how that will promote equity, or how that will promote public safety. So make sure to include in your policy brief an implementation science findings. Highlight what was studied, where, and with whom. So where did this study came about? How do you know that this evidence or this proposal that you want to move forward is actually works well? And also share key insights. What worked and also what didn't work and why. Because you need to be transparent. And you need to emphasize real world relevance and scalability. How is that relevant to our community and how it can be scaled up later? So you also need to include policy recommendations. When you present a problem, you need to suggest solutions. Offer 2 to 4 clear, actionable steps. Like include implementation strategies such as like funding mechanisms or partnerships or legislative change, and note like potential barriers and how to overcome those barriers. These are very important information because again, when you provide this information for the policymaker, you need to give them all the strengths. It's actually, I made this analogy before. It's like you want this policymaker to bake a cake, but you need to give not just the recipe. You need to give them all the ingredients piece by piece, and so that they can put together the cake and present it. So it's just you need to unfortunately you do need to give them all the pieces. And also, you need to add on a policy briefing, quantity, quantify like expected outcomes. What do you expect is going to come out of this implementation? Are you going to reduce hospitalizations? Are you going to improve access? So what do you expect that is going to come out of this? And also include cost effectiveness, like data, if data is available, of course. And also mention like pilot success and stakeholder support. And that's the part where you can use data from other communities. You can say this was pilot in other communities similar to ours, and it worked well, and show that evidence. And the last part of a policy briefing is the call to action. That's when you end the policy brief with like a strong appeal, what you want the policy maker to do next. Include like your contact information for follow up, of course, but how do you, what it is that you want this policy to do. So this is pretty much, what a policy brief is. So now some tips for success. Well, first, like I mentioned earlier, brief should be 1, 2 page, maybe 3 tops, and if you're doing a presentation, under 10 slides. So you don't want to give something that's too overwhelming and lose the interest of the policymaker. Also use plain language, avoid academic jargon and tailor to your audience, know their priorities and political context, and also follow up, offer to meet, provide like more data or help with drafting the legislation. So do you need specific language? We can help you with. So let's walk through one case study to highlight some, the process that took to implement the opioid overdose data and prescription drug monitoring program, which is actually a national scope policy. But I'm going to give you a different example later of something that's more local. But this is actually an important example. So to see how the importance of evidence-based data and also the evidence of translating science to towards where policymakers can understand. The opioid overdose data, prescription drug monitoring program, the background. This was in the early 2000s. Public health agents, they began to collect and analyze data on opioid-related overdose. Emergency room visits and also prescription patterns all over the country. The data revealed a sharp rise in opioid misuse, particularly involving drugs like oxycodone and hydrocodone. So what was the data that was delivered to the policymakers? So CDC and the state's health departments, they actually provide data, reports showing, geographical hotspots of the opioid overdose, Medicaid claims and pharmacy data was also provided, which highlighted the patterns of doctor shopping, or in overprescribing. The individuals who were actually getting prescription in different pharmacies in different places. Also data of mortality showed a surge in overdose deaths, especially in rural and economically disadvantaged areas. So how did the policy translation happen? So what happened? So prescription drug monitoring programs were actually enacted in nearly every US state to track controlled substance prescription. This database, they actually allow prescribers and the pharmacists to monitor patients' histories and flag like risky behaviors. As patients, buying, getting prescriptions from different pharmacies to accumulate volume. Some states made the prescription program mandatory before prescribing opioids. The use of PDMP mandatory before prescribing opioids, while others actually integrated them into the electronic health records for easier access. So some states, implemented it differently, but they did. So what was the actually impact of this program? Studies show that states with the robust PDMPs, they saw like reduction in opioid prescribing and overdose rates. Also, the PDMPs became a cornerstone of federal and state opioid response strategies, supported by funding from agencies like SAMHSA and ONDCP. So it was a very effective, program. So why this matters for implementation science? This example pretty much illustrates how real-time cross-sector data, like from healthcare, law enforcement, public health, can actually inform targeted and scalable interventions. It also shows the importance of presenting data in ways that resonate with policymakers, emphasizing cost savings, public safety, and also health outcomes. So I have a second case study, which is, it's not as, national of a national scale. It's just to give an example or a situation that could actually happen in your county or in your area and how you would deal with it. Okay. So this example is focused on expanding naloxone access through county police policy change. So the setting is, we're talking about a mid-sized county, that has a population of about 250,000 people, which has experienced a sharp rise in opioid overdose death, particularly involving fentanyl, which, you can relate this to many counties throughout the US. So naloxone was available to first responders, but not widely accessible to the public. And the county had no standing order or like funding for community distribution. So who were the advocates? So there was a small coalition that was formed. They called themselves Families for Recovery and Safety. And this small coalition was actually formed by two parents who lost children to an overdose, also a public health nurse, a recovery coach, and a local pharmacist. They had no formal political power, but they actually had, strong community credibility. They were known in the community because of what happened. So they were the perfect group to get together to start this movement. So who was the target policymaker? In that case was a county commissioner. And this county commissioner, he had chair he chairs the county's like health and human service committee. It was actually physically it was physically conservative but politically concerned about overdose deaths, and also had not taken a clear position on opioid prevention programs. So this is the portfolio of the press. That's why it's important to know. See, they got to know who they are talking to. So what was the strategy that led to success? First, they did their homework. Before contacting the commissioner, the group gathered, the county-specific overdose data, fatal and non-fatal. They actually got cost estimates showing, naloxone distribution was cheaper than actually emergency response. They actually gathered examples of neighboring counties that had these standing orders already in place and how well that worked for them. So why does that work? Because they framed the issue as a local, practical, and solvable, not ideological. So they actually gathered data that would inform the commissioner that this is actually possible because it has been done in a neighboring county. Second, they requested a short, respectful meeting. Instead of protesting or demanding action, they actually sent an email short. We would like to appreciate 20 minutes to share data and discuss options the county could consider to reduce overdose deaths. So not threatening, not impolite. So it's very respectful. So why does that work? Because the policymaker are more receptive when they don't feel ambushed or accused. They also combine data and lived experience. At the meeting, the nurse presented a one-page fact sheet showing, the data from the community. One of the parents briefly shared their child's story, something short, at 2 minutes, how the child overdosed. The pharmacist explained how a standing order would actually work operationally. So for someone who understands that. And they actually avoided graphic details, of the overdose deaths or whatever, but they focused on policy relevance. So why does that work? Because the data appealed to logic. It was like a personal story, which created like urgency, and the operational details like reduced fear of like unintended consequences. So you actually gave the commissioner they gave the commissioner, solutions. They gave like pathways that he could actually visualize, how things could operationally happen. They also made a clear, achievable ask. They didn't go to the commission and said, we need you to end the opioid crisis, because it was obviously something beyond reach. So what did they ask for? They asked for simple things. We need like a county-wide naloxone standing order. They also ask, for $50,000 in pilot funding for like community distribution. So they didn't ask for $3 million. They asked for $50,000, which is a very reasonable budget within the context of a county. So also a progress review after 12 months. Again, very reasonable. Once we do this, we do a progress review to show how that is working. So why it works? Because the request was like specific, time limited, and budget conscious. Again, they didn't ask for millions of dollars. So they actually addressed concerns before being asked. You know, they proactively address common objectives. They're already prepared. If somebody in the commissioner office says, "Oh, naloxone encourages drug use," they already had like cited evidence to the contrary that they could actually use. When somebody says, "Oh, what about the cost?" They can show the ER cost savings, the emergency room cost savings, by doing that. And if somebody talk about public safety, they noted like law enforcement support. They show that law enforcement is already on board with this idea. So why it works? Because they reduce political risk for the commissioner, because they already provided all the information. If the commissioner eventually is questioned in regards to these misconceptions, so that the commissioner will already have the answers. And also they build what we call the quiet alliance. After the meeting, they actually met individually with two other commissioners, to talk about the same issue. They secured a letter of support from the sheriff saying that the police department would be on board with helping with that. Also, they asked for a local hospital to endorse the proposal. And why it worked? Because by the time the issue came to a vote, it was no longer felt like a controversial issue. It felt like something part that was part of the community. They also use media carefully. You know, they publish like a measured op-ed, focus on saving lives, on mentioning bipartisan support, and they have avoided attacking anyone. So they didn't go to the media and said, oh, our commissioner is not supportive or the county is not doing anything about it. No, they actually were very conscious of what kind of information they put in the media that did not actually made the commissioner and people from the office that will vote and create these policies uncomfortable. They were not put on the spot. So the commissioner was quoted positively. They quoted, the commissioner, the idea was presented and the commissioner was well receptive. So why does that work? Because public recognition made it easier for the policymaker to say yes. And what are the outcomes? So the outcome was that the county approved the standing order unanimously. Naloxone kits were distributed throughout libraries, health clinics, and outreach teams. And within 1 year, overdose deaths dropped by 18%. So the program actually became permanent and actually was able to be expanded. So what's the takeaway of this example? What actually drove the success? They focus on local data. They combine evidence with brief, respectful personal stories. They made a specific, realistic policy asks. They didn't ask for things that were not possible. And they created, the way that they presented, they actually reduced political risk for the decision maker. And they built support before public votes. And they framed the issue as public health and physical responsibility. Fiscal responsibility. So that's the example and the information that I had to bring for you today. I would like to open up for questions if you have any questions. Or if anybody has some example that you'd like to share, uh, you know, that's also something that we can entertain. You can type on your on a Q&A or in a chat.
Do you see the comment in the chat, Humberto? Yep.
Okay, I see one here. Okay. With the current change within our legislation, how do we deal with keeping the interest at the agencies to engage? Again, by providing them with the local data, provide them with specific data and specific strategies that that is work, that's proven to work. You need to do your research. And I know that there's a lot of change happening throughout this current administration. Like it happens in all administrations. People have different priorities, they have different perceptions, but you need to be resilient with the facts that you have in your community. The fact is that the opioid epidemic is still a very concerning issue, and that it needs to be addressed. So you gather all the data that you have, and try to find information to counter the misunderstanding, the misinformation. That's how you navigate the situation that you pointed at here. So, any additional questions?
As everyone is thinking of questions or any comments, stories that you want to share, I did just put some reminders in the chat for you all, so please make sure you take that post-event survey. It is greatly, greatly appreciated, and it is how we are able to continue to provide free trainings to you all, so that your feedback is very important to us. Certificates of attendance will be sent out to everyone who attended today's session in full. And then the slides are available on our website. And I will be working on posting the recording by the end of the week. So we're going to leave the floor open for any other questions or comments.
If you don't have questions, I'd like to thank you for attending today. Um,
Well, if we don't have any other questions, we do have some thanks for you in the chat, Humberto. This was a great session, and if you missed his two previous trainings, they are also on our website, so please take a look at those. We love working with you, Humberto, so I hope to see you all again soon. Have a
Thank
great
you very
rest of your
much.
week, everyone.
Thank you. Have a great rest of the afternoon.
Thanks, Humberto.
Thank you.